Good morning, ladies and gentlemen. Welcome to Cynosure Australia, Cynosure University. Thanks for joining us today, guys. My name is Christian Bell of Cynosure Australia, and today we have something very new and very exciting for you. We're going to be talking about RF microneedling supported by the new Potenza RF microneedling system. So guys, I say new for a couple of reasons. Yes, it's new technology. It's a new product for Cynosure, which means new treatments for you as practitioners. But also, and more significantly, I feel that with Potenza, we're reaching a new level of applications and capacity with an RF microneedling device. So we're almost rendering all other RF microneedling systems conventional. When you look at the advancements and new possibilities and new treatments you can do with Potenza RF microneedling. So guys, as always, at Cynosure University, we aim to bring you the most prominent, the most experienced doctors from around the world to help guide us through the education, and today is no different. In fact, today I think you have a few extra benefits. You have a very wonderful, a very positive, a very fun doctor from the US, and she's going to help us through today's session. So if you would all please welcome Dr. Diane Quibell. Diane, how are you today?
Oh, I'm great, and I'm actually Tuesday night, so thank you for inviting me into Wednesday morning, which is the future. So that's why I wore my little futuristic outfit for you, and thank you for having me. I love Australia.
Thank you so much for joining us. It's really wonderful. Ladies and gentlemen, today we're going to run for 1 hour. If you want to ask a question, you can, and we please encourage you to do so. You can click on the question mark icon in the corner there and type your question in, and it'll come up for me to read into the discussion. No one else can see the question, so you can make spelling mistakes, and you can go ahead and do that, and I'll work it into the discussion. So please, Dr. Quibell, help us understand more about the device, but first up, could you let us know who you are and where you practice?
Sure. So I'm a cosmetic physician, and I practice outside of Boston, Massachusetts, on the East Coast of the United States. And I've been in practice for 30 years, but I've done aesthetic medicine for the last 20 years. So I'm on my I call it the fourth generation of devices. Every 5 years, the science changes tremendously, and it's very important that we keep up with cutting edge technology, first for ourselves, and secondly, that's really what my patients expect. They're always looking for something new. What's new? What's exciting? What can you offer me? They're always looking for bigger results and less downtime, which is a difficult thing to deliver for patients. But I think Potenza comes really close. So I've been working with Potenza for the last year. I am about 30 minutes from the Cynosure clinic by drive. And so I was very privileged to be able to go in and work with Dr. Sean Doherty, who is the medical director of Cynosure. And I basically did all the trial patients in the clinic. And we formulated the protocols that you'll see in the clinical reference guide. And we were really going for optimal results and minimal adverse events and minimal pain when we developed these protocols. And it took some doing, because as you'll see, there's so many combinations and variations on this device. In the beginning, it was almost too many, but now that I know how this device works, I feel like it's just enough of variation. And I do use all of the modes on this device, and I'll share that with you as we get through the PowerPoint. So I think with that, let's begin, and I'll show you what the device looks like.
So how long have you had the Potenza?
So we had the Potenza, we purchased it in February, and then unfortunately we had the unexpected pandemic shutdown in early March through almost the end of June. But fortunately, I actually had a lot of experience. I've treated hundreds of patients in the clinic. I worked in the clinic twice a week for 4 months before this device was FDA cleared. And you can even see here, here's some of the treatments that I actually did. The medical director, Dr. Doherty's listed on there, but those were my treatments that I did. And we'll talk about these different tips. It's phenomenal.
Okay, excellent. And you mentioned earlier, you know, ultimately we're looking for maximum results with minimal downtime. And you said this kind of comes close to it. RF microneedling is traditionally a good bang for buck treatment because of the intensity of the treatment itself and the injury caused, or the deliberate injury caused by the device and its wound healing response. So how does this stack up for your patients?
Well, you know, it's very interesting because you'll see when we do a treatment and right after the treatment, it looks like it's going to cause a lot of downtime. But the next day, and I have photos to show you, the recovery is very accelerated. And I'd like to go through and explain why. So let's start by just talking a bit about microneedling, and a lot of people are asking for this. It turns out that in the States in 2018, 1.2 million treatments were performed, which translates to about $630 million, according to the ASD, the American Society for Dermatology. And as you likely know, 70% of consumers are considering undergoing non-invasive treatments. So what is hot now is not big results, it's big results with limited or no downtime. And that's always a challenge because we always say there's no such thing as a free lunch. So usually you have to pay the price, but this device actually comes pretty close. And that's actually why we purchased it for our practice. So I want to just review a little bit about other devices. And you can see here the evolution of microneedling on the far left. You've got these rollers that often can be used for home use, and they cause a little mechanical only injury to the skin. These that are used for home devices or by beauty therapists and estheticians usually don't even go down to the blood layer, the papillary dermis. So it's just an epidermal abrasion. It's similar to exfoliation. Where if you go with one of these devices, this is a needles only device, and this one goes deeper. So this one goes down to papillary dermis where we actually have our blood supply, and you'll see some pinpoint bleeding. And this does work, but it just creates mechanical only injury. So for me, I've been doing devices for 20 years. I am the vice president of the American Board of Laser Surgery, and we now call them energy-based devices because we don't just use lasers, we use radio frequency and other types of energy to create injuries on the skin to ultimately get great results in wound healing. So here you can see this is radio frequency guided microneedling. So it's not just needles, it's needles plus heat. So I think needles are good, heat is good, but needles plus heat together gives you control and definitely precision to deliver your heat exactly where you want it, and probably more importantly, where you don't want it. And where you don't want heat is right at the dermal epidermal junction, where you can have inflammation and you can actually have coagulation at that level, can cause thermal injury with an adverse event. So now our needles are really controlling exactly where we put the heat. And that's what makes this device different than so many other devices on the market. So I want to show you where this compares in, these are some Cynosure portfolios of some of the devices they have. These are probably the most popular ones. And just so you know, I have purchased every single one of these. So Cynosure doesn't give us these machines for free, although I always do ask for free tips. Christian, for Christmas or whatever holiday you're celebrating, I'd love a free box of tips. I like the I-25 Tiger tip.
The Tiger tips. So you know, I mean, we'll get into it in a bit, but you know, earlier I spoke about the Potenza being a new level of RF microneedling, almost rendering every other RF micro conventional. And Tiger tips are certainly one of the features of Potenza that makes it, you know, or advances its level. What is a Tiger tip?
Yeah, so if you'll bear with me, I have a slide to describe it, and I'd love to show you on the slide. If I could just go
Right.
through where we go with Potenza, because I think people will find this surprising, Christian, that we have over
Yeah.
here the most gentle treatment. This is our temperature envy. And of course, we are doing sublethal heating, perhaps 42 degrees with a 4 megahertz monopolar device. And this works nice for your younger patients. But if you want a bit more result, you have to move to the more aggressive treatment. So you'll notice the next one I put here, which I love this device. This is the PicoSure Alexandrite. The 755 wavelength was ideal for targeting melanin, which is what we want. And the focus lens on this creates a laser-induced optical breakdown, or essentially a plasma injury under the skin, and it stimulates a dermal wound healing response. And this doesn't really give us much downtime at all, and a series of these treatments gives a nice result on the upper papillary dermis. Now the Potenza works really ideally deeper down. So these needles will go deeper into the skin. And when you see a patient after, you think, oh, they're going to be down for a few days. And you'll be shocked the next day, they're not really pink, they're not really puffy, and they rarely even have little micro scabs and crusts. They really tolerate the procedure extremely well, especially when you combine it with other things that enhance wound healing, like platelet-rich plasma, which is one of my favorite things to do. Or if you're trying to augment the collagen response, I'll show you how we use a tip on this and infuse and help deliver polylactic acid or liquid Sculptra, from delivering it from the surface of the skin and not using a needle to inject it. And then I have the icon over here. So certainly the IPL is non-ablative, but if you're heating blood vessels, you're going to get some swelling. And I feel like the downtime with blood vessels or fractional 1540, it's a bit more because of the heat. Here you have controlled deep heat, and you have heat throughout all layers of the skin. So I think the icon gives a bit more downtime. And then obviously CO2 laser, ablative laser, is going to cause a removal of the epidermis, and that will have to re-epithelialize before you go out. So that's your biggest laser injury unless you're doing surgery with the temperature platform. So I'd like you to know where it fits in there. So when we compare the RF microneedling to the light-based devices, and this is so great for you in the southern regions of Australia, especially when it's warmer climate or summer, we really have to be mindful of people's melanin. And so if they have a tan or if they have dark skin, we really have to be mindful of the Fitzpatrick skin types. Where with radio frequency, it's colorblind. We can do all types of the body on all types of skin, all times of year. And so this is something that's very fantastic, because if we even have a tan patient, I can treat them. I just put the needles deeper. And so the risk of hyperpigmentation is very minimal with this device. And that's one of the great advantages. So I want to show you histological comparison. I actually asked Cynosure to make me this slide because I think it really helps you to see what the RF microneedling does with this particular needle. And this would be an insulated needle that's called the eye needle. So the eye needle comes with 3 types of pins, 16, 25, or 49. I like the 25 pins. I-25. Christian, you're writing that down. Christmas is coming.
Yeah.
And so you can see the needle goes in, and look where you have your heat. Lots of heat, coagulation, in fact, 60 to 80 degrees centigrade, and you get tissue denaturation, but you don't get any injury up here. So you have a controlled location of the heat, and it's not controlled by the chromophore. So over here, these are all targeting the water chromophore. So you're going to have a variable response in different people's skin based on how much water. And clearly CO2, you've got the ablative zone and the coagulation zone, and you've removed the skin. Erbium YAG, you have more ablation than coagulation because of higher water absorption. 1927, you have less of a deep zone, so the healing is better, but you still have some coagulation near the DEJ, which can trigger PIH, post-inflammatory hyperpigmentation. And then, 1540, interestingly enough, I want to show you this. It's similar down here, but you can't get heat in the lower zone without also heating the upper zone. And so that's why with 1540 fractional laser, you get a lot more edema. You have this full thickness swelling. And I don't think it's necessary to have swelling up here to get your best results. I think controlled heat at the base, the way we're seeing it with the RF microneedling, is a more contemporary way to get great results with lower downtime. And then lastly, this is our Pico Alexandrite, the PicoSure laser-induced optical breakdown under the stratum corneum, but above the dermal epidermal junction, and that triggers dermal inflammation without anatomically injuring. So I want to show you why one of my favorite combinations is PicoSure with Potenza. Look how far apart the injuries are. The Pico comes from the top down. The Potenza really is located as deep as you put your needle. And so this is a very popular combination for me. Also, maybe IPL with radio frequency. So I like to use my Max G or my Max Y with the Potenza. I think that's also a great combination therapy. For those of you who are out there and you have other devices, use what you have to give your patients the best bang for their buck with a single treatment. So when we look at the evolution of Potenza, you know, here's your traditional microneedling. And of course, we know that using heat is better. So here you can see what heat does. We can actually target acne. We can improve melasma and also not worsen melasma, which I think is very important. We can deal with these very fibrotic type acne scars. And we can also treat rosacea because all of these require some heat. And then with this special tip, the cushion plush, CP21, there's 21 needles. This has a vacuum and it actually pushes topical medicine into the deep parts of the skin. And I'm going to show you a video on that. Very, very exciting. And that's really new. And then it allows you to actually infuse various things without sticking a needle into the patient, other than using the microneedle channels for drug delivery. So lots of different options here for all your patients coming through. So let's go over how RF microneedling works. We've got our tip, and then we're going to step on the pedal, and all at the same time, the needles deploy to the depth that you set, and you can set the depth from as little as 0.75 millimeters all the way up to 4 millimeters deep if you wanted to go into the subcutaneous fat, or if you had really thick fibrotic skin. And at the same time the needles come down, you're going to also get the heat delivered. And in this representation, you can see the tip that we call the tiger tip. The tiger tip has 2 breaks in the needles, so there's actually 2 zones of heating. So one pass treats 2 zones of heating, and that's one of the important things that we'll review. And then all within a flash, you can see the needles pull back up. And there's also a light that comes on. And then ultimately after this injury, once we get wound healing and repair and remodeling, over the course of weeks to months, we get new collagen and new elastin, the 2 proteins in the extracellular matrix of the dermis that give us our improved skin texture, our lifting, our tightening, and our wrinkle or ritid improvement. So here we go. So this is talking about what's new. So there are other microneedling devices, but this is the only one, I think, in the world that actually has all 4 modes in one machine. So we've got 4 modes. Let me go over monopolar and bipolar. That is how the electrical energy is delivered to the tissue. And then we have 1 and 2 megahertz. So those are the 4 modes we speak of. And in my typical patient, I actually use all 4 modes, especially when I'm treating the face. So that's quite important. I'll show you where I use the tiger tip. I really like that when I'm treating necks and also when I'm treating bellies. And then there's many other tips to choose from. So you've got 4 modes. You've got this tiger tip. In addition, there's this single needle tip that can be used in monopolar mode into blemishes or sebaceous hyperplasia or other benign growths. And then in addition, you have this drug infusion tip, which is very exciting. So this is quite a busy slide. I'm going to orient you over here. Let's look at the motor handpiece. And these, you have the tip right here. So these are the different types. You've got insulated needles. They come with 16, 25, or 49. And you're going to have your total energy somewhere between usually 600 and 1,000 millijoules during every pulse. So think of this, if you have 16 needles with all that energy, you're going to have more energy per needle. If you have 49 needles, you're going to have less energy per needle. So I actually have found it, this is my favorite tip, the I-25 tip, these insulated needles that actually allow the electrical energy to flow out only at the break in the needle that's insulated, which is right at the base. Now, this is where it's different from the tiger tip. So here you can see with the tiger tip, the energy is coming down and the energy will flow out where there's a break in the needle. So it will flow needle to needle in the case of bipolar mode, or it will flow from needle to grounding pad in the case of monopolar mode. And turns out that's a bit more gentle. But on this slide, I really want you to see the difference between the tiger tip needles and the insulated needles. This one gives you 2 zones of heating. This one gives you 1 zone of heating. And if I'm using 1 zone of heating, I typically use 2 passes, 1 deeper pass followed by a second pass, a bit more superficial. Now let's move over here to look at this very exciting drug infusion tip. We don't have this FDA cleared in the States, but I've worked with it in the clinic. It's phenomenal. It's the Cushion Plus tip, and it has a vacuum and it allows for enhanced penetration of a topical that you apply to the skin. And I'll go over that in more detail in just the next few slides. And now we have the AC handpiece, which is the single needle here. And you can see just a single needle comes through and it's in monopolar mode, and you are really just putting coagulation right into a blemish or right onto a telangiectasia or a syringoma. And that's how you can treat these active acne inflammations or these blemishes, these nodules or pustules. So let's look at this drug infusion tip, Christian. This is very exciting. So we've got this mechanical needle, and now of course we're going to insert it with RF energy. We use this in the monopolar mode most typically, and we can add a topical drug, in this case, polyl-lactic acid, and we do it all in one shot. So here's how it goes. You've got step 1, and you're going to have actually the needle injected, and there's air coming in and out of the tip. So when you activate the tip, the skin gets vacuumed up and pulled into this needle array. And then you actually deliver the energy. It all happens automatically. And as I mentioned, we usually like to use monopolar. And then when the needle airflow is removed, in turn, the drug actually gets pushed into the needle holes. So you have safe and effective delivery of drugs. So make sure these are drugs that you want in the dermis and they're not meant to be placed on an intact barrier. So we just don't go throwing in vitamin C or anything else that's meant to go through a corneum. We really have to make sure this is suitable for injection, because you'll see it goes right down to dermis. So here, when you put something on after conventional RF microneedling, you see it doesn't go in very well. But with Potenza, specifically with this tip, you can see how much greater drug delivery you get in these micro channels. You almost get the same type of delivery as a mesogun, but the trouble with the mesogun is you have too much of an infusion of substances. So that sometimes can cause problems. If you're using Sculptra, there's a risk of getting lumps or nodules. In the case of a steroid, it just may be too highly concentrated. So I think the Potenza is great for micro drug delivery or baby drop Botox if you're treating skin texture or rosacea. So there's lots of different options. And let me run this video. You'll see how cool this is on a gel auger. You can see this cushion tip, and when the needles come up, you can see with the dye here how deep we're infusing into the tissue. So in each of these channels, we're sucking up and then we're infusing into the skin. And this is something brand new and super exciting when you think about it. So PRP is a real popular one. In fact, in my clinic, I treat everybody with this with PRP unless they don't want me to draw their blood. So the other modes that we want to talk about is 1 and 2 megahertz modes. And just to show you a higher frequency, this is a higher frequency. Obviously, it's going to be a bit more intense. And this is a lower frequency, and it's going to be a little bit more gentle. And that's important. When you talk about monopolar and bipolar, the needles actually change. So if you're in bipolar mode, the needles switch from positive to negative and the energy flows needle to needle, and it doesn't go deep. In the monopolar mode, all of the needles are the positive electrode, and they're all grounded to the neutral pad, so the energy gets pulled away from the dermal epidermal junction. I feel like that's really important when you're trying to minimize PIH, or you don't want to be too close to the surface with your coagulation. And that's why it's so great to have the gentler monopolar mode that we sometimes need. So here you can see you've got different ways to adjust the depths from 0.5 millimeter to 4 millimeter. And here's your 1 pass, but you're getting 2 zones with your semi-insulated tip or the tiger tip. And then your single needle here. And then here's your insulated tips. And monopolar mode would be pulling you this way, and bipolar mode would be energy going needle to needle. So there's so many different combinations, really endless combinations with this device that will really suit safety and efficacy for your patients. And I always like to show a little histology. So this is the 49 pins that was treated on some porcine skin. And you can see the classic H&E stain. We have stains, special stains for collagen 1 and 2. And on the top right, the Mason trichome and Victoria blue, just to elucidate that we're seeing coagulation in the dermis. And actually, if you're using less energy in monopolar, you do get coagulation surrounded by a sublethal zone of injury that is a bit more gentle. So to summarize, here's your 4 modes: 1 megahertz and 2 megahertz, monopolar and bipolar. You want to be really aggressive, go into 2 megahertz with bipolar, and you get really precise. If you want to be a little more gentle and treat a wider area, you go into 1 megahertz with monopolar. And I usually keep it that way. So I decide gentle, monopolar 1, more aggressive, bipolar 2. I generally don't do bipolar 1 megahertz or monopolar 2 megahertz. So that's what I have found to be really my best options for getting me the most optimal outcomes for patients. And I want to show you before we get into the photos, I thought this was really great because Potenza is not the first device to the market, but it is the first device with all these options. And I like to think of it this way. I kind of like my iPhone. I think I have the iPhone 11 or 12, the Pro or the Max. And I know the iPhone was not the first intelligent phone to come to market, but it certainly is the most popular because it really has a lot of options. And that's kind of how I look at Potenza. So you can see here, comparing to all the other devices, it's the only one with all 4 modes. And these other devices have either one or the other mode, but most of them not both. And I do use all 4 modes in most of my patients. You've got different types of needles, including the single needle, and a lot of the other technologies don't have a lot of that. And most of them have enough power, I think, with the exception of a few. Some of them, this one doesn't have much pulse duration, so this would not be one of my favorites to go to here. But you can see that there's really everything you need in this machine, comparing it to the other technologies that are on the market. And you've got all those needles to choose from. So here you go. Here's a patient immediately after treatment from Dr. Firmonti. And you can see when you're doing the treatment, you'll see some pinpoint bleeding. I keep that to a minimum because I use a topical anesthetic with prilocaine in it, which of course is a vasoconstrictor. So that's really nice for microneedling or when you're doing filling and you're using a topical. But right after, they're very red and a bit puffy, but not terribly puffy. And here's a patient I treated, and you can see here on her neck, diffuse erythema, but 18 hours later, not even 24, almost no swelling, and the redness is gone. So the recovery is really phenomenal. People go out the next day after this treatment, and that way they don't mind coming back in a month for another therapy. It doesn't take them a whole week to heal up. So it's really very accepted by patients with regards to the recovery and the healing time. So now I'm going to bring Christian back to see what else we need to talk about.
Yeah, look, I mean, excellent presentation, Dr. Corbell, and it's been very beneficial for me. I'm going to be taking on this device nationally in Australia, and it's really wonderful that you've given me such a big head start in all the work you've done with it and your explanations. I had a few questions, and I wanted to ask along the way, but you were doing such a good job that I thought I'd just wait until now. But do you mind if I kind of backtrack a little bit and maybe ask you about some things you talked about?
Please.
Okay, so we talk about RF microneedling as an advancement beyond traditional just microneedling that was done in the past. And with the addition of radio frequency, we can amplify the neocollagenesis and therefore get better results for patients. So when it comes to now introducing cosmeceuticals or medications through the infusion tips, are we amplifying the results again?
So that's such a great question. I'm going to say absolutely yes, because we actually have a way of sneaking by the epidermal barrier, which is really designed to keep things out. So we actually have a water part of that barrier, and we also have a lipid part of that barrier. And we've always had challenges getting things in. So if I have somebody with melasma, I like to use this device, and I put on topical tranexamic acid that's actually made for injection, but I drip it onto the skin. So I do use this device for drug delivery. If I have a fibrotic acne scar patient, I'll use a 10 to 20 milligrams per ml concentration of triamcinolone or Kenalog, and without sticking it in with a needle, I'll just drip it onto the surface. So this works not just as a device that's going to stimulate new collagen and elastin and improve all the concerns that you've spoken about, but it also is a way of delivering drugs to the deeper parts of the skin. So it really is a great advance.
And so in addition to treating melasma, where do you see the indications for this new infusion tip?
So I think anything you want to get into the skin, I think this does a beautiful job. So we have a thing in the States, mesobotox, or little small amounts of Botox, and I say Botox, I mean neuromodulator, botulinum toxin type A. Sometimes we use a special injection technique or a special needle to get small amounts of micro Botox into the skin. It can prevent the release of acetylcholine, which can trigger blood vessels in the case of rosacea. And it's also been shown in and of itself to rejuvenate skin. So imagine if you combine Potenza, which already rejuvenates skin when you don't put a topical on, and then you put some micro Botox or polyalactic acid or topical steroid or tranexamic acid, which is going to block the production of melanin. You can now get these things into the skin and have an enhanced drug delivery. So I think the combinations are actually endless.
Okay, excellent. Look, I'm certainly very excited about it. It's always good to have a system that aids in patient efficacy and whatever we can do to try and give clinics and doctors more bang for their buck when they're treating. And of course, because it takes RF microneedling to a new level and gives doctors something new to do with the device for better clinical outcome. So I'm extremely excited about it, and it is TGA listed here, so we can talk about it, and better still, we can do it. So I'm very excited to explore that a bit more. I did have a few more questions, if you don't mind. Can you tell us what areas of the body are treated best with Potenza?
So I actually have a personal preference, and why I got it is to treat the neck and the jawline. So those are areas that we really struggle with as we get into middle and later age, where we lose some of the reticular dermis support on collagen. And it's really hard to get enough heat down to the reticular dermis without causing scarring. So we have a RF device that's fractional, but it's going to cause a robust coagulation, and that coagulation is going to be deep enough and focused enough to not destroy other parts of the skin scaffolding. So for me, the neck and all the way up to the jawline is my #1 for this device, because I really have a hard time treating that area. Also, we will treat a bit more superficially on the décolleté, and I love that with infusing PRP. I had a patient in this week, Christian, who had melasma, and she said she has a lot of allergies, and she was nervous to do even Sculptra. And I said, how about we draw your blood, spin it down, and we'll use your own platelet growth factors to repair and improve healing and upregulate and modulate the outcome, because you're not going to be allergic to your own blood. And so she was actually quite excited about that. So those are some options that this system gives you.
And, you know, I like RF microneedling. I love Potenza because it's treatment. It's really treating. You can tell by the tissue response and the patient response post-treatment that we're successfully delivering a significant deliberate injury to the tissue. And I like that because, you know, that's going to equate to results for the patient. But also, we want patients to come back, and we want patients to adhere to their, you know, set of treatments. Is it comfortable, or how comfortable is it?
So, you know, that's always, for those of us who treat patients, I find that I have a patient who said this to me, and I think it's great. And I said, you know, some of these treatments are uncomfortable. And she said to me, Dr. Cobell, it's more uncomfortable for me to look in the mirror. And I thought that was something that was fantastic. So I will tell you, I had a treatment done on my neck, and for me, it wasn't terribly uncomfortable. I did use a forced cold air chiller on the neck, and I had a bit of topical anesthetic on there, and that actually can help. For patients that you're concerned about discomfort, we do use a high prescription strength 20% lidocaine prilocaine formulation, and we just have them sit with it a bit longer if they're nervous. So our general time is 20 to 30 minutes. If they're nervous, we'll actually give them 40 minutes of numbing, and that's usually enough to get them through that, plus the Zimmer chiller. So it's not a comfortable treatment because you're putting needles in, but I will tell you, when you're delivering the heat the way we have it figured out, the patients usually do get in a rhythm. So the sides of the face is usually not a problem, but when you get around the upper lip, that's very uncomfortable, whether we're doing hair removal or resurfacing. This is, I think, the most uncomfortable area of the body. So what I do is I do a bunch of passes over here, and I say, okay, 3 bad ones, 1, 2, 3, and then I'll come back and treat over here. Okay, 3 more bad ones, 1, 2, 3, and I kind of do it that way. And that actually makes the treatment a lot more comfortable.
That makes sense. That's a really good point. And how long is it taking you to deliver, you know, a neck treatment or a full face treatment?
So a full face, I generally put 700 pulses in, and I'll tell you my protocol, I like the I-25 tip, the insulated needles. And what I like to do is my first pass, I go deep, about 2.5 millimeters, and deeper if someone has thicker skin. I like that deeper pass in bipolar 2 megahertz. I want to get my deep coagulation far away from the DEJ. And then on my second pass, so maybe the first pass is about 3 to 350 pulses. And then on the second pass, I bring the needles up to 1.5 millimeters or so. And now I flip into 1 megahertz monopolar mode, and I treat here. So I like to have treatment at 2 layers. So my typical face treatment takes about 700 pulses, takes me just under 30 minutes. And I do always do the jawline. If I'm doing the neck, The neck is faster because I use the S-tip, and I like the S-tip when I'm on extrafacial skin. So neck skin, abdominal skin. If I'm treating arm laxity, that's another area I really like the semi-insulated or the tiger tip. And in that case, I'm treating at 2 levels with 1 single pass. So on the neck, I do about 300 to 400 pulses in total. So about 150 or 200 pulses on one side and 150 or 200 pulses on the other. Be careful on the lower neck not to go too deep. Important.
Okay. And so tell me, if you were a doctor out there watching this webinar and you had been looking at this modality for your practice and you wanted to integrate these types of treatments, and when we listened to you talk about depth levels and different types of medications you can infuse for different indications, you know, what is the learning curve like, and does Cynosure provide you with enough training and materials to be able to get going?
So that's a great question, and you really want to be asking that of your device provider, like what's involved for me with training. And so we've worked really hard to get the clinical reference guide to get people out there, get their best protocols. And I would suggest you start with the protocols that we found very helpful. We give you a range of treatment options. If you do find the treatments more uncomfortable, when you deliver the energy more quickly, in other words, with a shorter pulse width, you can usually make the patient tolerate the treatment much better than having a longer pulse width, keeping the heat on for longer. So I like short pulse widths, and I use more power in the watts for the same total energy. And I find that that is fantastic. So I would say start with your clinical reference guide. It's actually just you have to follow a recipe. The only thing you want to watch for on the face is, you know, I like to do like a 10% overlap from spot to spot. And I want to remind people that in the under eye area, you have to pull your needles up a little because the tissue is thinner. Same on the forehead, you have to pull your needles up a little. And really the only risk here around the eyes is you could hit a perforating or reticular blood vessel and get a bruise. So if you see that, I always have my staff hold pressure with gauze or a cotton swab so the bruise doesn't actually extend to the deep tissue. But it's really an easy treatment to do. And I think Australia is lucky, Christian, because they've got you to help them through. And I would say start with the initial protocol you get from your trainer, and then evolve and find what you think works best for you. And if you learn that, you should encourage your providers to share that with you. That's what we do here. And if you invite me back in 6 months or a year, I'll share with you all the updated things that we've learned in treating with this new device, the Potenza.
Yeah, that's an interesting comment about sharing protocols and things. I'm certainly working on a project here at the moment to assemble a medical expert panel of doctors who will go on to provide education on Potenza and all the different treatments and indications and settings and protocols, like you say. And this is kind of an organized way of helping all of our Potenza practices understand the system and get a bit of a head start from listening to a group of doctors who have been, I guess, tasked with the job of creating this and sharing that information through webinars, etc., as we get into next year. And, you know, some of those doctors are actually watching this webinar right now, considering joining my medical expert panel. You know, what would you say to those doctors in terms of, you know, collaborating with a company like Cynosure and doing these types of activities? Do you find them stimulating, beneficial to your career? You know, you work with Cynosure a lot doing this type of education. What would you say to other doctors in Australia who are thinking of doing that?
So I think there's a lot of companies that make devices. And if you just want to buy a device and go off on your own, that's certainly one option. But honestly, you're not getting the most out of it because we all learn from each other. We learn in collaboration. And I always, when I'm speaking with another physician and I'm considered an expert, I always have the goal of let me learn one thing. Maybe it's a post-treatment thing that I can actually do to improve healing. Maybe it's a technique, maybe it's an energy setting, but we should all be out there with the goal of helping each other get all of our patients to love the devices we have. Because if the word amongst the consumers or the patients are, this is a great treatment, we're all going to benefit from it. So we need to actually have a network of collaboration. So bravo to you, Christian, for creating that.
Absolutely. I think it's the right thing to do. I think it's beneficial for everyone, as you say. And it's also fun for me to collaborate with a team of doctors. I've done it before here in Australia, and I've really enjoyed the process. And it's all about relationship building and forming a collaboration outside of, you know, the actual supply of a machine, because there's so much we can do together as practitioners and companies, you know, to sort of work together. So why don't we go through a few of these cases, and I might try and feed some more questions in as we go.
Sure. I think that's great. And I think it is important that we're humble, and the goal here is to establish what's the best practice with Potenza. And when a device is new, you don't really know the best practice. You hope and you say, I'm going to work with the protocol given, but inevitably over the months and years, as we use these devices as experts, we really learn new things about them. And I think it's really our moral obligation to society and mankind and to our profession to share those great outcomes with each other so we can all win. And I think, you know, that's something that's very important, that we do this in community for the greater good. And I've learned that from the pandemic too. We have people up here that just are stubborn and they don't want to wear masks, and it's really a form of selfishness. So I've been to Australia 4 times. I hope to come a 5th time at the end of this pandemic. And I think we all need to help one another. As they say, we're all in this together.
Agreed.
So here, let's go over some of the treatments. And this was a patient I treated in the clinic. And you can see here, I put, you know, I always save the good picture for the first one to get your interest. But you can see, of course, the texture in the upper neck. And remember, the skin on the upper neck is thicker than the mid and lower neck. So you can be deeper with your needles and you can be more aggressive. And that's where you really need the lifting. As you move down the neck and go a little lower, you really need to be a little bit more gentle down here. So this skin is much thinner. So always just remember how thick your skin is, and that will help you determine how deep your needle should go. And on this case, we used the S-tip. We did about 350 pulses, and it really only took about 20 minutes. This is a single treatment, and it's about 6 weeks after the first treatment. Well, here's a gal, she was super happy with her results. And, you know, on first glance, you say, oh, I don't know much, but look over here in her mid face, okay? And you can see just the tone is better. And remember, we're using a fractional device. We're not treating all of her pigment, although you certainly could combine this with the Max G or your IPL, or you could combine it with your Pico laser. But also, look, we did neck as well. And you can see after 3 treatments, she's definitely having some remodeling and some tightening in the neck. And she's having a little bit more definition on her jawline. You can go deep into this jowling pad of fat. And you can even go down 4 millimeters and coagulate into the fat to get some fatty improvement as well. So that's something I also like, to really put these needles in deep and go into the fat where you don't want it. And this is that same patient close up. So you can really see the improvement in tone, and certainly the texture improvement is there after the 3 treatments. And as you know, it takes 6 months or more to build collagen. So these results will continue to improve until about 6 months after the last treatment. And here, this is a clear result. And just to be clear, this patient only had 1 treatment from Dr. Takahashi, and there is no filler here. So when patients ask me, what should I do first? Should I do filler? Should I do Potenza? Potenza every time, because you may get a lifting of the tissue and you may not need as much filler. This patient may need an extra syringe to efface these folds, and they probably have a little sagging up here, whereas if you can lift them, you can usually efface, especially the proximal part of the fold, and then sometimes you just need a little less here. But even if you look at the side of the oral commissure, there's a little bit of sagging of tissue, and this is really lifted up nicely. So I think this is a great treatment, and these results should be as long lasting as any other device, like a microfocused ultrasound or a CO2 laser. So I always tell people your best is going to be 6 months after the last treatment. And what I like to tell people is expect 3 to 5 treatments at the outset at a monthly interval. And then we should plan on doing 1 treatment once a year just to maintain your level of improvement, because you do lose 1 to 2% of your collagen per year after the age of about 30. So you've got to do something at least once a year to maintain those results. And this gal, she was one of my favorite patients. She worked in a prison as a guard, and she had a lot of great stories. And you can see here right off, I think you can see she's got rosacea, and her rosacea got much better just with this treatment. It wasn't anything related to anything else we were doing. She's never had neuromodulator, as you can see by her glabellar complex. And we talked about having her do that after the study. She was excluded from allowing to have that with the study. And you can really see her skin looks brighter and smoother, even just after 1 treatment. So she was quite happy to come back, and she found the treatment very tolerable. And other patients found the treatment was a little bit more uncomfortable. So again, back to that varied treatment response of how people are doing. Now here's an extrafacial treatment. You can see after 2, of course, we were going for contour improvement here, but we treated this whole area with needles that went really deep. We went up to 4 millimeters into this fatty area, and we did a high density. And you can see we definitely got some fat atrophy. And that's actually been reported with monopolar radiofrequency. And you don't want pits in the skin or contour deformities that would not be suitable, but to have diffuse fatty removal, that's quite nice. And it's almost micro amounts of fat because it's just coagulation at the needle tip. So I never expect contour deformities with this. And here's an example from Dr. Takahashi, who's actually in Korea. And you can see this very fibrotic acne scar, really quite severe from cystic nodular acne. And just to remind you, you can treat right over acne, pimples, pustules, and it's not going to cause a reactivation of acne. In fact, it usually improves the acne. So you can see a really great improvement here in just 3 treatments. And to show you the healing, I might have another slide that actually sequences that. So let's go to this guy here. This is Dr. Yoon in Korea, just 1 treatment. And you can see going right over blemishes. And we usually use the Cushion Plus tip here. And I like to use PRP. And you can see where these red areas are. Those often turn to post-inflammatory hyperpigmentation. But if you clear the blemish quickly, you can actually remove even the red area, and the skin looks perfect, and you don't see any residual in the area of post-acne scarring.
Thank you. And, you know, with that last patient, there was also some really nice contouring of the jawline as well. So with these cases that you've shown, and you were involved in a few of these cases, what was specific to Potenza with regard to these cases? So we've learned throughout your presentation that Potenza has a few unique features, like it has monopolar. It uses tiger tips or semi-insulated tips that release energy at 2 points along the needle rather than just the end of the needle. We've also talked about drug infusion. And so where have those additional features that are unique to Potenza played out in the cases that you've shown?
Yeah, so when I've shown you the facial treatments, and I'll just jump back quickly. So for example, this gal, I'm going to tell you the protocol I use on her is a 2-pass approach. I like the I-25 needle for the face. For the initial pass, I go deep with bipolar, 2 megahertz, and I'm really doing some intense, deep coagulation, but I'm keeping that far away from the dermal epidermal junction. I do worry if you bring the needles up and you do too much bipolar coagulation, I think you can actually see injury at the surface. And I think I've even seen some laxity in some cases. So that'd be ironic. We're trying to treat laxity and we don't want to have a wound that's going to accelerate that. So when I do my upper pass, as I approach that dermal epidermal junction, I want to be more gentle. So as a general rule, I keep the insulated needle, and now I turn into monopolar at 1 megahertz. And so now I'm delivering the energy and I'm pulling it away from the surface of the skin. That is the whole point of microneedling, is to control the heat and keep it away from the DEJ. So that's why you even see on our darker phototypes, you know, we just don't see hyperpigmentation. We just don't see hyperpigmentation here. And we've got a lot more slides and photos coming in. I'd be happy to share with you, Christian, after the webinar, so you can get these around to your doctors once we get patient's authorization to release the photos.
Yeah, I think, you know, this has been great, and it's a really fantastic overview of the entire system and all of these new features unique to Potenza. And perhaps as we progress into next year, we could focus on some of those things and run mini webinars that look at certain aspects of the device. If you're happy to join us for those next year. So just a couple more questions, Dr. Quibell. So with post-care for these treatments, you know, what are you doing, and can it actually improve the clinical outcome?
So, you know, we need to do a study on absolutely improving, but I think theoretically it completely makes sense that when we apply something, for example, like polylactic acid into an acne scar, we are going to get an augmented collagen response. We never see nodules the way we do when we inject polylactic acid in an area, for example, of muscle movement, or if it's too superficial and not deep enough. But we are adding something to the device. So we have the device plus a topical. So that really gives us sort of endless combinations. So I like to think of all our patients as patients that we have to try things on. And if somebody's got hyperpigmentation, I'm going to be sure to go deeper, and I may use topical tranexamic acid or some other lightening agent that I feel safe is able to infuse. My usual for the first treatment is always let me use PRP on patients. It accelerates healing. And in the clinical study, in these photos, we did not use any topicals because the trial did not allow for that. But in my clinical practice, patients are so excited that we're able to combine with topical platelet-rich plasma or some of these other agents we've talked about. So I think we should come back in about 6 months or a year and share our best practices for tips and tricks and clinical pearls so we can all learn from one another.
That's great. And tell me, how does this fit in with other treatments that might be used for particular patients? So if you have a patient on a set of different treatments, perhaps some injectables as well as Potenza and some laser, what's your feeling around when and how to deliver a multi-mode approach to one patient?
So I think when you're starting with a device, just do the device only until you're comfortable with how it's operating and how it works. But for me, since I have comfort with this device, I'm very able to combine this. So two of my favorite combinations is the Pico lens, where I use the Pico Focus, which really only creates an anatomic injury in the above the dermal epidermal junction. And then I will use the Pico Focus and even maybe some flat beam to target pigmentation on 100% of the skin. And then I'll go into focused areas or do the whole face with Potenza to ramp up new collagen and elastin. So Pico and Potenza in the same day, in that order, great treatment. Another one is IPL, immediately followed by Potenza. IPL, you're targeting plaques of benign epidermal pigment, or you're getting rosacea, and then Potenza, you're heating deep collagen below. So those are combinations that I will do. What I won't do is combine this with anything with a deep microthermal zone like the fractional laser 1540 or fractional CO2. I think you can have too much overlapping of beams. It turns out if we get more than 500 microns of width in damage, we can have bulk heating and scarring. Of course, we never want that. So I will not use this with other fractional devices. And lastly, I sometimes do combine it with Tempsure. So I would do a Tempsure, for example, with the 4 megahertz with maybe a 20 millimeter spot on the neck, and then follow with Potenza. So The combinations are endless, and I think that's why we should get back and talk about what best practices we've learned.
Excellent. And so, you know, just person to person, practitioner to supplier, has Potenza been a worthwhile addition for you? And have your patients, you know, what are your patients saying about it?
So for me, it's new in my office because I've just really started with it for the last 3 to 4 months, but it is gaining traction. And patients actually have been asking me for about a year and a half, when am I getting a radiofrequency microneedling? And I knew this one was coming because before it was cleared by FDA, which is a regulatory body in the States, I knew we had all these 4 modes coming. So I told them to hang tight. And when it came, I would actually put it up on my website and introduce it into our social channels. So we've had patients now, it's coming out of summer here, we're coming into fall, and that's when patients come and start wanting, now that they've damaged their skin over the summer, they want to get some repair going. And patients have really accepted this treatment. And I will tell you, it has a very favorable price point. Do you want me to share with you sort of the price we charge in US dollars?
Please.
Yeah. So for a full face, we actually charge somewhere between $1,000 and $1,200 US dollars. If we're going to do the face and neck together in combination, we actually charge $1,800 US dollars. That will also include PRP, and then they come for about 3 treatments at a monthly interval. So really one treatment a week. After 3 weeks, I'm making a profit if I do more than 1 treatment a week. And that's pretty easy for me to do in my clinic.
Okay, wonderful. Well, we're right on 1 hour, and I promised our audience that we would stick to an hour. So I must say thank you so much personally for giving me so much education right up at the top of this session, and to running through these practical Q&As. We actually have a number of doctors that had posted some questions to me in advance that we've addressed. So that tells me that a lot of people are very interested in the outcomes with this device and the additional features that are unique to Potenza. I think we've covered them, and as we've said along the way, we'll probably do some more into next year and focus on particular things. But for now, thank you so much for giving up your Tuesday night to be with us, Dr. Quibell. It's been wonderful, honestly, and we've appreciated everything you do for Cynosure and for the doctors here in Australia. So thank you so much.
Thank you so much. Christian, can I say one last thing? It's important.
Go for it.
Great. So you did ask about fillers, and I never quite got back. And I do want to tell the doctors, if you're filling in the supraperiosteal plane or deep sub-Q, you don't have any problem with Potenza before or after filler. But if you're using something like a skin booster or introducing an intradermal filler, of course, if you put a needle through and get coagulation, you can cause small amounts of removal of that filler. So if you had a patient who just had that, I have them wait usually 3 to 6 months for the filler to wear off before I start with the needles.
That's great. And I think, you know, going into next year, I'm going to be running a lot of live workshops again once COVID subsides. And we're going to be able to do a lot of this practical discussion in a live format again. So just for the viewers on the webinar live with us right now, if you want to participate in one of those live workshops, just put a yes in the question mark. So just hit on the question mark icon and just put a yes in there, and I'll add you to my invitation list, which will help us to get you along to those sessions. So again, thank you so much, Dr. Diane Quibell, and you have a wonderful evening.
Thank you, everyone. Have a wonderful day. Happy Wednesday.
All right, now I'm going to work out how to turn it off.